Something's up with this one. So I went and followed him. Can you believe? He was going into the litter box, not urinating, coming back out, meowing, crying. I was like, oh my God, is he blocked? I palpated his bladder. He was blocked. I took him straight to the ER and got him sorted out. Cats are masters of deception, including my two. Masters at it. They can be walking around, behaving like everything is okay, and then all of a sudden, they're crashing on you. Why? Kidney failure, hormonal imbalances. They're so good at hiding when they're ill. A lot of times when they come into the clinic, it's already too late. And that's not what I want to happen to you. So we're going to go through 1 to 5 in order of the priority of what I see in the hospital. Number 1, skipping annual blood work. I cannot stress this enough. This is important, essential to trying to figure out if your cat is having any underlying issue that a physical examination and questioning cannot bring out because they hide their symptoms. So we need to know what's going on beneath the surface of that skin, what's going on with the liver, what's going on with the kidneys. Kidney failure is very common. Are they headed towards diabetes? These are all common conditions that we can see in practice. And the only way for us to get to them early, where it's treatable, manageable, or even curable, is to actually do annual blood work. When we do this, we catch things early and we're able to do something about it. So emphasizing, do not skip your animals, your cats in particular, their annual blood work. Number 2, free feeding dry kibble. Cats are obligate carnivores and they are used to getting their moisture from their food. So because we're feeding dry kibble all the time, and I'm guilty of that sometimes, they are not always getting the requisite wet content, the moisture content that they need to keep themselves hydrated. The simple solution, add in some canned food, which has a lot of moisture, add in some canned food to their meals. You could do this once a day. You could even do this 2 to 3 times a week. But this is going to help them to add that moisture content without having to worry if they're actually eating their dry food and actually drinking the water. This is the best way to ensure that they continue to stay hydrated and not be prone to urinary tract infections and, of course, predisposing to urinary bladder stones. Number 3, ignoring the mouth, oral health, dental hygiene. This is something that it's very common in the cat population because we just feel like our cats basically look after themselves. And that's a myth. That's actually not true. They need just as much care as our dog pets, sometimes even more. Can you imagine that we are ignoring the mouth when they are prone to something called tooth resorption, where they can get like this exposure and wearing down and eating away of the white enamel? And you look at your cat and it's like, what's that red dot? That's actually the blood supply that's visible now because the enamel is worn away. So this is something that cats will suffer through. They will suffer through it and not cry and whine like some of us do or some of our dogs do, but they will suffer through it, and then we don't know until it's too late. And then I have a cat on my table and the cat actually needs full mouth extractions. You do not want this to happen to you. Why take the chance when it is preventable? I really don't know. And that's why I'm doing this video, so that I can educate you guys, so that you know that you need to pay attention to your cat's oral health. Mistake number 4, over or under vaccination. So inappropriate vaccination protocols. In veterinary medicine, we have something called core vaccines and non-core vaccines. So we have a set of our clients that go, I don't want no vaccines at all. I don't want no vaccines. I'm anti-vaccine. Okay, no problem. That's not really what's healthiest for your cat. But then you have that other pool of people who go, give me all the vaccines now, give me all the vaccines. That's not the right approach either. So what you want to do is have that conversation with your doctor, with your veterinarian, and they will help you to decide indoor versus outdoor, exposure. Does your cat go on the patio? Does it not? All of these things make a huge deal in terms of trying to determine what is best for your unique cat, not the cat next door or the cat at the shelter, your unique cat, because they are all unique. We cannot broad brush them and assume that they're going to be protected from the things that they're going to be exposed to. So this is important for you to have the conversation with your veterinarian. And if your vet can't tell you the difference between a core vaccine and a non-core vaccine, you need to change your vet. Number 5, I'm coming up to number 6. I have a bonus one, number 6. Number 5, Not paying enough attention to timely spaying and neutering, that is, removing the ovaries and the uterus, ovarian hysterectomy, or removing the testicles. Yes, I said it. I said testicles on YouTube. So we need to spay and neuter our cats. I have an entire video about why it's essential to spay and neuter your dog, and the same applies for the cat. So please feel free to watch that video. You'll get some more detailed information. Cats can have endometritis, pyometra, pyo meaning pus, metra meaning the lining. Cats can have mammary tumors. Almost 80% of the mammary or breast tumors in cats are malignant. Yes, I said it. 80% of them can be malignant. Why would you want to take that chance when you can remove the ovaries and the uterus, remove that hormonal influence, and your cat can lead a longer, healthier life? Likewise, you're not going to get reduced incidence anyway of your cat getting any of those testosterone related tumors, prostatic issues. It is just something that you want to pay attention to. Again, speak to your veterinarian and they can help you figure out when is the right time to spay and neuter your cat. And I'm right at the bonus number 6, sir. So here's the question. Come close. How many litter boxes do you need per cat in your household? Yeah, I know the answer might surprise you. This is something I ask my clients all the time, and they're like, really? Oh, I didn't know that. And then they have to go and do that thing. They have to go and figure out how many litter boxes do you need per cat in your household. Thank you guys so much for watching. Please feel free to subscribe to my channel because this helps me a lot and it helps me to get that word out so that you guys can be better suited to help your pets lead a longer, healthier, and happier life. I'm Dr. McCubbin, a practicing veterinarian, and this is Vet Unfiltered. See you in the next one. Peace.